Hi everyone again. Okay, so this is part 5 of lecture 4 and we're going to talk about prevention approaches. So, prevention interventions focus on reducing risk for mental health disorders and promoting positive psychological health. Prevention interventions are typically classified into 3 categories. Universal, which we've talked about in terms of our previous parts of the lecture. Selective, which is also known as targeted, and indicated. The development of preventative approaches and those which promote independence and well-being have gained importance since the implementation of the CARE Act 2014. And it shows how important legislation and policies are to making positive change. But they're not the be-all or end-alls. Often there can be good bottom-up approaches, grassroots approaches. Prevention and encouraging people to be more proactive about their health and well-being is also central to the vision of the NHS 5-year forward view. And again, this is another example of a much more top-down process. So the NHS 5-year forward view is really an interesting read if you want to. But we also give examples of bottom-up approaches and grassroots. So what is prevention? Prevention is a broad concept and refers to a range of meanings and actual interventions. And these include protecting vulnerable people, including the elderly, from preventative harms. And these can be falls or seasonal weather or extremes and the impact of that, so flu and cold. And preventative approaches are things like flu jabs or vaccinations. Prevention also includes interventions that relate to promoting health and well-being with a view to preventing or delaying the need or more costly services, and providing low-level services to maintain people's independence. And they can also relate to any kind of intervention that helps prevent the need of institutional care. And we've talked about that earlier in some of the intervention approaches and so on. Avoiding crisis, which might lead to hospital admission and readmission. Again, anything that facilitates the prevention of having hospital admissions is very, very important. And then reducing the impact of long-term conditions also. Okay, so levels of prevention. There's primary prevention, which is about preventing ill health, poor well-being, and improve the overall health and well-being of the population. And they're very much linked to prevention programs. And then the secondary prevention, which is early detection of disease or poor well-being, e.g. scanning or screening. And then there's tertiary prevention, which is about improving treatment and recovery. Improving quality of life and reducing symptoms of disease or poor well-being. And what's important here is improved access to care, programs of support, etc. So there's some good examples there. And in terms of mental health and mental disorders, it's just interesting to note that since 2008, which is quite a while ago now, but the World Health Organization in Europe have partnered up with the European Commission to run projects to empower users of mental health services and families. So it's been running for a good time now, and I think hopefully we're seeing the fruition of that within some societies across Europe. Types of prevention include lots of things, and here's a list. So I'm going to pick out some examples here because you can read the slide. But as we've said, early intervention is one of those aspects that's really important. And also, like we've mentioned, primary mental health prevention, suicide prevention, anything that helps reduce risk factors. And then there's more specific ones like risk management, safety, fire prevention, crime prevention. There's lots of different areas. And for some other prevention examples are things like that are a bit more specific, are things like being informed and making choices. And, this is where information and advice, person-centered care, and strengths-based approaches are really common and proved effective. There's also things around connecting individuals and communities. So examples of this are home share pilot programs, community-related research and practice, befriending, mentoring and peer support, social prescribing, local area coordination, tackling loneliness and isolation, and preventing loneliness and socialization. So promoting independence and well-being is also important, and this is fundamental to prevention in a more broader sense and relation to well-being. Independence and autonomy and empowerment is really important, and making informed good choices and connect with individuals help empower you and promote independence. And these are just some examples of ways of doing that, particularly for the older population. So you'll see there that there's prevent pressure ulcers. That's particularly related to older people. And yeah, reablement is really important as well. And intermediate care is also a really important aspect. These are just some examples, but there's so much more, but it gives you a taster of what's out there. And it helps people live their lives in a full way and take care of themselves and others. Other prevention examples are education, really. It's probably fundamental, and the earlier you reach people, so children, the better. So exciting changes are taking place in schools to reinforce the important interrelationship of education and mental health. And improving child and adolescent mental health and well-being will improve the individual's life trajectory and reap untold benefits to the socio-economic fabric of society. And mental health and well-being services are shifting away from traditional models of healthcare and into local locations such as schools, and also to improve schools help improve access to care and increase availability and diversity of non-specialist mental health workers and well-being practitioners. So schools really do provide an access, a gateway, a pathway for young people, and it can have massive positive influences and impacts on children's lives. And obviously the knock-on effect to our economic and socio-economic status is really important. So finally, the conceptualization of mental health is expanding from the focus on clinically defined disorders to broader dimensional approaches to mental health, approaches that are well suited to the school environment. So rather than only thinking of mental health, which obviously is a very important aspect of well-being, so rather than thinking of it just as clinically defined and disorders, mental health is being seen much more broadly and very, very linked to well-being more generally. So there's much more overlap with well-being kind of concepts and language, and with mental health language and concepts. Mental health interventions can be perceived as those that promote mental health, such as improving self-esteem, those that prevent mental illness developing, especially in children with known risk factors, and those that treat diagnosed illnesses as well, of course. And the school environment provides opportunities to promote resilience as well. And resilience is important. Again, we can deconstruct the idea of resilience in our seminars, so do remember to be critical when when you're dealing with some of these very popular terms. So things like enhancing teacher support and positive peer networks can help with promoting resilience. And in terms of reducing exposure to risk factors such as bullying and academic stressors, it's really important to have well planned and well delivered prevention strategies. Now, there's, again, just like interventions more generally, there's targeted prevention, which is synonymous with selective prevention, and it's directed toward individuals or population subgroup that is identified as being a relatively high risk based on characteristics of the groups. So we've mentioned targeted and universal prevention approaches right at the start of this section. Universal prevention is similar to primary prevention and involves directing intervention to an entire population. Universal approaches attempt to affect every individual in a population, whereas targeted approaches select candidates for interventions based on screening of demographic or behavioural characteristics. And the image here on the slide just shows you some of the, and this is from Public Health England, just shows you the kind of risk associated with both types of approaches. And what it's generally saying in a crude way, it's saying that universal approaches really are better than targeted approaches because what they aim to do is prevent, they're more able to prevent, harmless things happening to people, and they will more likely promote positive well-being in general. When you're dealing with targeted approaches, sometimes it can be too late, so that's where the risk is higher, because if somebody's already gone through too many risk factors and stressors, it means more time and money has to be spent on that individual or group of people. So the earlier the intervention, the more universal the intervention, that tends to reap better rewards. But again, that is a crude way of saying it. There's lots of different examples. To go on to end this the lecture, I'm just going to speak about the well-being in relation to public health. And we've talked a lot about public health in this whole lecture, but I just want to focus in on it just to end the lecture with. So, who is responsible for public health and well-being and prevention in the UK? Well, the government perceives there to be a number of levels of responsibility for public health and promoting well-being and developing preventative services. Excuse me. These include individuals and communities, GPs, local authorities, directors of public health, local health and wellbeing boards, Public Health England, chief medical officers, NHS Commissioning Board. So lots of different people and organisations are involved, with public health and wellbeing promotion and prevention. And the Healthy Lives and Healthy People paper is a really useful one to read up on if you want to know more about this, particularly based in England. So it's really complex and lots of people involved, and every organisation will take slightly different aspects and will mobilise different methods and also have different agendas. And then these are mainly top-down processes, but there's obviously a lot of grassroots bottom-up approaches, which are more like charities and local social enterprises. So implications for commissioning. Responsibilities for local public health are now firmly placed with local government as set out in the Health and Social Care Act of 2012. And local authorities are in charge of driving health improvement, collating evidence on public health and public health interventions. But they're also responsible for ensuring that the right mix of arrangements and services are in place to meet the population health and wellbeing outcomes. This means that local government has to ensure good partnerships with and between key players such as the NHS, social care, housing, environment, of health, leisure and transport, as well as service users, carers and local population. So you can see with the complexity of everything that they are very aware of the multiple layers of influence on an individual's health and well-being, like the Bronfenbrenner socio-ecological model illustrates. Health and wellbeing boards are the forum where key leaders from the health and care system work together to improve the health and wellbeing outcomes of their local population and reduce health inequality.